Hello everyone, welcome back to Confessions of a Midwife. Today we have lovely Tanya here with us today. She is a diabetic specialist. So Tanya, you can take over, just tell us what your job role is and what exactly you do.
Hi, my name's Tanya. I'm a diabetes specialist midwife. So my job is about diagnosing ladies who are pregnant with gestational diabetes, caring for those with gestational diabetes, type 1 and type 2 diabetes through their pregnancy. Most of our care is in the antenatal period, so before baby is born, but we do come and review ladies when they're in labour to make sure everything's going okay. We run education sessions about healthy eating, how to check your blood sugars and the importance of good nutrition and exercise during pregnancy to help control blood sugars, to help reduce the risk of complications for baby.
Great. Now, a common question you must get a lot is, how do I become diabetic during pregnancy? How did this happen to me?
Okay, so some people have more risk factors of developing diabetes in pregnancy. Common ones are your ethnicity or your family history, so having mum, dad, brother, sister with diabetes, having had diabetes in a previous pregnancy, or being overweight are more risk factors. And it's actually caused by the placenta producing hormones which make your body resistant to insulin, so the blood sugar rises during the pregnancy.
Okay, I hope that answers everyone's question who's watching. Now, how can women that are on diet control their sugar level? What can they avoid completely?
Okay, so the main diet that healthy eating is what we recommend. So we want ladies to have some carbohydrates with each meal, but it's the type of carbohydrate and the amount. So wholemeal carbohydrates, whole grains, so brown bread, wholemeal bread, brown rice, pasta, brown pasta can help control sugars, and it's actually the portion size. So we do tell them about portion size. So carbohydrates is about portion size is your size of
Just
your
the
fist.
size of your fist. Oh, that's not much, is it?
No, and lots of ladies go, oh my God, I'm going to be hungry. So we encourage you to eat plenty of vegetables. Most vegetables are fine and will help fill you up and are good for vitamins and minerals. Protein, so meat, fish, chicken are also going to help fill you up as well. And it's about having 3 meals a day, breakfast, lunch and dinner, and if hungry, snacks between meals, and trying to choose what we call low carbohydrate type snacks.
So can you give us an ideal meal that you'd like a woman to describe her 3-course meal throughout the day, what she's been eating? What's the ideal breakfast?
So breakfast, ideally something like 2 slices of wholemeal toast or granary type toast. You can have 1 to 2 eggs, you could have some mushrooms, tomatoes, spinach with it, lots of different vegetables, or a portion of porridge which is 35 to 40 grams made with semi-skim milk and water. Water is one of the best things to drink. Try to avoid things like smoothies and fruit juice. They are very high in sugar. Lunchtime, it could be a fist-sized portion of basmati or brown rice, a vegetable curry that does not contain any starchy vegetables like potatoes. So it could be chicken, fish, vegetable with aubergine, tomato, okra, those sorts of things. And dinner time, similar sort of thing, or maybe a small jacket potato with some chicken and a nice big salad. You can have up to 1 to 2 portions of fruit each day, and that is just what you can hold in the palm of your hand. So it might be a small apple, 3 or 4 grapes, because they still contain sugar, although they've got plenty of vitamins and minerals, which are essential. And evening times, if you're hungry, having something like some nuts, some cold chicken, boiled egg as a snack, So you don't want too much sugary foods in the evenings because it can affect sugars overnight.
Now, during pregnancy, a lot of women get all sorts of cravings. A lot of women have a lot of sugar cravings, like chocolates and ice cream. I don't know if they're made up cravings, but a lot of women do say they have a lot of cravings at this point. Now, having a small amount of this, if they are diabetic, is that okay? Or should it be completely avoided and they should suppress their cravings?
It's very, very hard to suppress the cravings, and sometimes if it is best to try and avoid them. And if you do feel that you do need them and you want to have something, it's about a portion size. So if you really craving for something like chocolate, instead of having a big bar of chocolate, it's just 1 to 2 small squares, but only occasionally. Other things, I had a lady craving couscous. So she wanted couscous with her dinner. She also wanted to snack on couscous. So it's about trying to find other things to have instead, which can be difficult. But if somebody is unable to control those cravings, which is very difficult, then we may need to start medication to help keep the sugars normal, to reduce the risk of complications for mum and baby.
So if you are on diet control, is there any kind of exercise you can do after you have your meals, or can they go for like a walk, or what's advised?
So walking is an excellent form of exercise, and every time you walk, then you're going to help reduce the blood sugar levels. And we generally say 15 to 20 minutes of walking after every meal. And you could incorporate that into your normal day. So you could have your breakfast and then maybe walk the children to school, or if it's lunchtime, have your lunch, and then if you've got to go food shopping, do your food shopping afterwards. So you're being active. If you're at home, it could be walking around indoors, doing some housework, walking up and down the stairs. If it's really typical British weather, raining, cold, a bit miserable, then doing something indoors is really good. You could put some music on and have a little dance around the living room. Obviously, if you've got young children, they usually like to join in. So it's going to get the whole family a little bit more active and healthy.
Great. Now, if diet control is not working, just to confirm, what are the normal ranges what your sugars should be?
So trusts have different ranges. So in our trust here, we recommend the fasting sugar, so first thing in the morning before eating or drinking anything should be between 4 and 5.3. Anything 5.3 and above is slightly high, and that can often be rectified by eating dinner by 7 o'clock in the evening, being active and avoiding any carbohydrate based foods after your dinner. And after meals, we check 1 hour after finishing your meals, and it should be between 4 and 7.8. So 7.8 and above is slightly high, and usually we try to adjust diet, exercise before we start medication. And if that's not possible, then we may need to start either metformin, which is a tablet, or insulin injections.
So it's always a diet control, and then it's the metformin, and then last resort is insulin.
So it really depends on what the sugar levels are and whether or not there's any scope for change in the diet and activity levels. And sometimes if the sugar levels are higher than we would like, then, and it also depends if they're high first thing in the morning, then it might be insulin straight away. But we have a look at it, we see what we can do first before we start insulin, if there's an alternative.
Great. Now, what are the side effects of sugars going out of control and not controlling your sugars?
Okay, so just like us, if we eat too much, then we put on weight. And just as the sugar is going in your blood to the baby, and the baby uses some for energy, but any extra sugar that baby doesn't need for energy gets stored as fat. in the baby. So they put fat on around their tummy, and when they put fat on around the tummy, it also goes on around their shoulders, and that can then cause complications for the birth. For most ladies, we're going to try for a normal vaginal birth, and if baby is bigger, then that could cause complications in the birth, increasing the risk of instrumental birth or baby's shoulders getting stuck, something called shoulder dystocia. So we want to try and avoid that by scans to ensure baby's growth isn't too much. Medication if baby is growing too much to help control the blood sugars, and sometimes induction of labour before 40 weeks, ideally between 37 and 40 weeks if baby's growth is too much.
Great. Thank you so much, Tanya, for all your tips. Hope you all enjoyed watching. Remember to share and subscribe, and see you next time on Confessions of a Midwife. Bye.